Welcome to the Intersex Truther. We'll be debunking a video by Maya entitled, Are Puberty Blockers Safe? So I'll be going through this video by this nice trans woman. And I have an intersex condition that mimics puberty blockers. So I've been living on hormone replacement for about, 45 years. So I have a lot of experience in this area. Although I'm not transgendered, I don't have gender dysphoria, I do have a intersex condition. And according to many websites on transgenderism, I'm right there with them. So I will comment on this.
If you're watching this video, it's likely you're looking for information about puberty blockers, something that has come up in media quite a lot recently.
Now, the High Court has ruled that children under 16 who say they want to change gender are unlikely to be able to give their informed consent to treatment with drugs that block puberty.
Maybe you're a child looking for information about puberty blockers. Maybe you're a parent that is looking about whether or not puberty blockers are safe or not. Either way, you're in the right place. Today's video is a bit different than the usual. Typically, my videos aren't aimed at children, although you're more than welcome to watch, but this video is more aimed towards parents. But this one is about children as a category and how we...
So this video I'm making right now is also geared toward parents, and it's to straighten out a lot of the disinformation that Maya's putting out on this video.
Called puberty, that can afflict your child. Now, puberty is, for the most part, a completely normal and healthy part of a child's development.
So puberty on every part is a normal development of a child, unless they have somebody like, for instance, me, who has a certain intersex condition which causes a dysfunction in the puberty. So
when we're talking about puberty blockers, we need to define what exactly it is we're talking about. The pure scientific stuff. But I want to preface this by saying that I'm not a doctor. I'm a historian by education and a YouTuber by trade. So take what I'm saying here with a pinch of salt.
Again, transgender people don't understand this subject. They don't go through this types of they don't have a condition that causes disruption in puberty. They don't understand what it's like to be stuck in adolescence, to go through anything that an intersex person has to deal with like Klinefelter syndrome, Turner syndrome, and my condition will testify if there's anything that starts interfering in that natural process. You can get chronic illnesses, you can get osteoporosis. I myself deal with rheumatoid arthritis. We have a lot of health problems, and it's because of these disruptions in natural puberty. Puberty is a critical function of a child's development and overall health of the child for the foreseeable future, including their adulthood, including when they get into the 50s and 60s. Things that happen in puberty affect things down the road, 20 or 30 years. I've been dealing with all these issues about hormones and puberty and all this for all my life since I was 13 years old, since the moment I started realizing there was something wrong with me. So keep that in mind.
Always be critical of the media you consume. Puberty blockers are a type of medicine that are called gonadotropin releasing hormone agonists. The chemical process behind these medicines are very easy. GnRH agonists act as agonists of the GnRH receptor, the biological target of gonadotropin releasing hormone. These drugs become peptides.
Okay, it says, I have no idea what I'm doing. Okay, so I have a very good idea what I'm doing. So I have a condition called Kallmann syndrome. It's commonly called Kallmann syndrome, although I do have some sense of smell, so they didn't classify me as Kallmann syndrome. They classified me as unknown cause of my hypogonadism. So basically, I do not produce the gonadotropin releasing hormones. That's because a part of my pituitary gland did not mature. It did not turn into the proper. It did not mature into the appropriate gland to produce those hormones at sufficient level to stimulate puberty. So essentially, I was stuck in a prepubescent stage. I was stuck at like standard stage 1, 2-ish, and at age 16 because I did not produce it at all. So what they are is puberty blockers are like Lupron, cause the pituitary gland to mimic my pituitary gland. So it causes it to go into a state of hypogonadism, which means it's not functioning. It can't produce those hormones. It's sputtering around. It can't produce enough hormones to cross a threshold into puberty or maturation of the sex glands. And what happens in this process is the gonadotropins go from the pituitary to the testicles in males, and they produce two things: sperm, and they produce eggs in women. So they're critical for fertility. They also produce estrogen and testosterone or androgen, masculine-gender hormones for males. And this creates, all the secondary sex characteristics, the lowering of the voice. All these things are created by those are created by those hormones. So in my condition, I did not have that. So I simply were stuck there until finally a GP looked at me and said, "You're not going through puberty at all. You need to get some help." And I went to the Pituitary Gland Center in Stanford in the 80s, and they put me on hormone replacement, standard testosterone hormone replacement therapy. And I started a medically induced puberty with masculine checks and going to the doctor, and they had a check board. Lupron and puberty blockers mimic my condition. So let's get back to our...
Very basically, is by inhibiting sexual hormones from being released. And they exist under many different brand names. But the one you're most likely to encounter is probably a brand name called Lupron. There's also a question about fertility. These medicines do prevent the production of sex cells that are needed to produce the miracle of life. And the idea is that if you, as a child, take these medications, you're not going to be fertile anymore. And
So this is it's a biological fact. If you take these medications, you will become infertile. There's no question about it. Whether or not you can catch up some of that fertility if you being taken off pituitary blockers, that's possible. But remember, if you stop puberty, you stop fertility. That's it.
And obviously that can be a pretty big deal because you might want children in the future. But here's the thing. These medications are reversible. There may be some slight effect to fertility, which obviously isn't great. But that's also why in many cases doctors will ask patients to cryogenically freeze sex cells before starting puberty blocking treatment. Because one of the earliest stages of puberty is developing those cells. That means taking eggs and taking sperm and sticking them in a freezer. Stages in puberty are classified according to something called the Tanner scale. And it's only after Tanner stage 2, around age 12, when children can even be prescribed puberty blockers to deal with gender dysphoria. This is because gender dysphoria in children can sometimes resolve itself, but if it remains after this stage, it is often permanent. This means that puberty blockers are only prescribed in stage 3, the same stage where sex cells are produced, but just before most secondary sexual characteristics.
This is, this is what's gonna help you, okay?
3, 2, 1. Ah, where's parts done?
Breathe, breathe.
Breathe. Where's parts done? Ah, done.
So I was stuck on like stage 1 till I was around 16. It's because I had no, my pituitary gland was completely dysfunctional. They're actually starting puberty blockers around Tanner stage 2. You hear that a lot. Women their eggs become viable around the end of Tanner stage 3. So Tanner stage 3 is at the end of that, their eggs can become viable. But remember, why are we talking about fertility treatment in prepubescent children? That's just bizarre. It's just absolutely bizarre to say, well, we want to freeze some of your eggs for 20 or 30 years down so you can have children. Remember, we're talking to a child about fertility treatment, and they have to go through a procedure to fish those eggs out, and hopefully they're mature enough to later have offspring. So we're freezing these eggs. With males, they're not going to produce enough sperm until standard stage 4. Till the end of standard stage 4, because the sperm, you have to produce a lot of sperm. I mean, what are you going to do? You're going to tell the kid, okay, what we're going to do is we're going to do this. We're going to have you go through standard stage 2, and then we're going to do this little surgery, which was recommended to me because, remember, I don't have these hormones. That you go in and you fish out. You go into the testicles itself and you fish out by cutting them, and you fish out all the sperm. And I don't think you can freeze out either. You need a lot of sperm. So this whole thing about fertility and preserving fertility treatment, it sounds like a lot of witchcraft. If anybody in the comment section who is a physician can actually tell me how you stop puberty and then you preserve fertility at this early age, please let me know, because this is just bizarre.
This is because gender dysphoria in children can sometimes resolve itself, but if it remains after this stage, it is often permanent. This means that puberty blockers are only prescribed in stage 3.
Part of puberty. So if they fulfill all the criteria with pubertal stage 2, which means you're just starting puberty, and everyone's on board. So the parents are on board, the therapist is on board, the physician's on board, and obviously the patient's on board. Then you can do this protocol.
This means that puberty blockers are only prescribed in stage 3. In stage where sex cells are produced, but just before most secondary sexual characteristics develop. And this way, fertility is preserved even in the eventuality that these medications would adversely affect your fertility, which they don't. But this leads me to...
Which they don't. Again, that is just completely wrong. It's just completely wrong to lie to parents that their kids' fertility is going to be preserved. It is a big lie of puberty blockers. It is a big lie that down the road they're going to have to deal with. Why would any medical professional tell this to a child? I have no idea why.
To the final argument, that doctors are experimenting on children. I mean, if we don't know the effects, aren't we just testing these on kids, seeing what happens? We don't know what's going to happen. It's a mystery, isn't it? We have no idea.
Children are basically being experimented on with puberty blockers.
It's a moral panic. We're experimenting on children. It's just like the Nazis. These comparisons annoy me quite a lot, but I do see where they're coming from. If you don't have a clear and simple answer about both the short and long-term effects of a medication on a child, but you're still prescribing it to them, you could see why some people would think it would be tantamount to experimentation, especially...
That's called common sense. So we're going to interfere with the kids' puberty, pretend like they have fertility, and make this all up because the child has gender dysphoria, and we're going to affect the kid's possible health for the rest of their life. But we're not experimenting here, even though the FDA has not approved any of these medications. We're just not experimenting it. We're just not. No, we're not. We're just seeing how it goes.
If you were under the impression that these medications are brand new, and it should be said that in the case of prescribing it to block the onset of puberty because of transgender reasons is something that is moderately new, these medications are not. These medications have been around for over several decades. Also, why would...
They came in around 2014 or 15. They started being used in transgendered medicine widely. For example, there was one gender clinic in the United States in 2007. There's now like 300, and they're all using this. And as this video was recorded, both Finland and Britain have put the kibosh on this because they are not certain that this is a correct treatment. But that's too late for some of these kids.
Unethical. In addition to this, it's also really important to mention that every single medication has side effects. There's not a single medication in the world that doesn't have any side effects. The trick is, though, to be able to monitor, track, and contain them. If you're taking
the side effects of puberty blockers are basically sex organs that no longer work because they have not been matured, just like aspirin.
Powerful medicine, you're going to have to talk to your doctor fairly often. Even me, just taking my normal hormone replacement therapy, have to go to the hospital and give blood samples at least once a year so that they can make sure that my bones are okay. Instead, we judge which medications are worth the risk of side effects and which medications aren't. The ones who aren't given to patients. And even with all of these concerns dealt with, there's still no overarching rule for how to deal with trans children, so to say. That sounded really ominous. There's no one rule for how to treat trans children, in the sense of there's no one rule how to treat anyone. That's why I have to talk to...
No, there's no run rule, but it seems like the run rule that's being promoted is medicalization of gender dysphoria children. It's not these hormone blockers. It's jumping to cross-sex hormones very early in life before things have matured. A lot of us in the intersex community who are not signing on to the 100-point plan of the transgender movement have a lot of issues with the fact that we're medicalizing children at this age. If they're adults, they can do what they want with their bodies. But as kids, I know that a disruptive puberty causes a lot of hardships later in life. Like fertility, I didn't even think about fertility. They warned me about fertility when I was a kid. I didn't understand. I didn't understand the consequences of that. I didn't understand that I could have gotten a different type of hormone early on that would have helped my fertility. But I didn't understand what they're talking about because I was more interested in other things. These are things that are very hard to understand. And on top of that, taking puberty blockers, at such a young age, and then following that with cross-sex hormones that have a whole slew of other side effects, including the fact that the primary sex characteristics of a child's given birth, if they're female and they're given testosterone, the primary sex characteristics such as their maturation will stop. So vaginas don't respond to testosterone, just like penises do not respond to estrogen. These organs go silent when you do cross-sex hormones.
To a lot of doctors before they will give you your medication, because they have to figure out if you, specifically you, are going to benefit from the medication that you're taking. And that goes for children too. That means that under the same rule set, different children are going to receive different treatment depending on what they need. And that is something that is decided by doctors and counselors and experts in the field. Some children might just want a few months to figure things out, while other children might feel so mentally unwell by the prospect of undergoing a biological puberty that they need this medication to stay mentally healthy. And because
So we're talking about they need this medication to stay mentally healthy. They need a medication to stop their natural process of puberty to stay mentally healthy. This is a physical alteration of a physical body, a natural process to remedy a mental process. You got to always keep that in mind. Transgenderism is in the mind. It's emotional. It is how you relate to your body. Puberty is physical. It is a natural process that all humans have to go through. So we're not concentrating on what's going on up here. Instead, we're injecting things such as hormones. So this is what I take. I don't know if you can see it. This is once a week. This is testosterone. It's given essentially like an EpiPen. It costs my insurance company around $1,200 per month, and I have to take it for the rest of my life. Now, a lot of these people are taking the junk, the oily stuff, which goes right into the muscle. You stab it right into the muscle.
Dysphoria varies from person to person. The effects of puberty blockers will also vary in their effectiveness, because they're effectively treating different things. Every child is, after all, unique, a small child from God. And it's also important to mention here that puberty blockers are not the same thing as hormone replacement therapy. Puberty blockers on their own do not cause a transition. They merely inhibit the natural transition that a puberty would cause. And it doesn't stop it entirely. It slows it down. Sometimes
it does not, it stops it entirely. Puberty blockers stop puberty entirely because you have to have a certain number of gonadotropin hormones in your blood to even start puberty, and it pushes it below that threshold. It also it is an equivalent of slamming your child's development. It's like going down a highway. Children start speeding down that highway, going through puberty, and you're slamming the brakes. You're not pumping the brakes. You're not going over the side. You're slamming them. You're just stopping them. You're stopping them in their tracks. And then you have to, ask them, okay, how does your gender feel? And as I will link to my story, before I went through puberty, I didn't even know what gender was. Thank you for watching The Intersex Truther. Like and subscribe. and come back for more content.